hospital stay for gastric bypass surgery. During your pre-op registration visit at the hospital, you will meet with one of the pre-op nurses. The nurse will review your medications, and you will be instructed on which medications you can and cannot take on the morning of surgery. During this appointment, you may undergo additional blood work, EKG, and chest X-ray. The nurse will also discuss taking a HibaCleanse shower. HibaCleanse is a special long-lasting antibacterial soap that can be purchased over the counter at any pharmacy. It is important to take a shower using HibaCleanse soap on the night before and the morning of your surgery to help prevent infection. Follow these instructions for your shower. You will wash your hair and body with your own soap and rinse. Apply a nickel-sized amount of HibaCleanse soap on a clean washcloth. Using the washcloth, wash body from the neck down to the pubic bone, which is just below your underwear line. Avoid the genitals. Concentrate on skin folds in the abdomen, armpits, breast, and groin. Leave HibaCleanse on for 2 minutes, then rinse. Repeat this shower the next morning before going to the hospital. You will need to bring a personal overnight bag to the hospital. We suggest that you pack toothbrush, toothpaste, slippers, and loose-fitting clothes for the trip home. Bring your CPAP or BiPAP machine if you are currently using one. You may bring a cell phone, laptop computer, or other electronics, but the hospital will not be held responsible for the loss or damage of these items. Remember to leave any valuables, such as jewelry, at home. When you arrive at the hospital on the morning of surgery, you will have an IV started. Any final blood work may be drawn if necessary. Any medications you receive will be determined by your surgeon and the anesthesiologist if needed. To prevent blood clots, you may have support stockings and a compression device that is applied to both feet and legs to promote circulation during surgery. You will also receive subcutaneous injections of a blood thinner that goes just under the skin in the lower part of your abdomen. This shot may cause some bruising. Family members will be instructed to remain in the waiting room and should have your permission to speak to the surgeon about your condition and surgery. The surgery time varies with individual patients, but you and your family can expect you to be in the operating room approximately 1 to 2 hours. However, if you have had previous weight loss or abdominal surgery, time in the operating room may increase. Your surgeon can give you more details regarding time expected in the operating room during the consent appointment. You will receive general anesthesia for the procedure. This involves placing a breathing tube into your throat so that oxygen and sedating medications can be administered. Some patients may experience a mild sore throat after surgery. We routinely perform weight loss surgery procedures using the laparoscopic technique. This involves using several small incisions to insert a special camera and surgical tools to perform your surgery. There are no visible stitches or staples. Your incisions will be covered with small strips of surgical tape at the end of the surgery.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. This smaller stomach pouch restricts the amount of food that can be eaten before feeling full. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. Bypassing a portion of the small intestine decreases the absorption of calories and nutrients. The upper portion of the small intestine is reconnected to the lower portion of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested.
Once surgery is completed, you will be brought to the recovery room. There, you may wear an oxygen mask for a short period and will be given pain and nausea medications if needed to keep you as comfortable as possible. Your IV will remain in place for fluids and medications. You will continue to wear the compression devices on your feet. Small white strips of tape called steri-strips will cover your incisions to keep them closed as they heal. As your recovery progresses, the nurses will give you ice chips and clear fluids in small amounts. They will also assist you with getting out of bed. Most patients can get up, sit in a chair, and take a few steps shortly after waking up. We encourage you to get up and walk shortly after surgery to help reduce the risk of complications. After surgery, a small amount of fluid may trickle or ooze from your incision, and this is normal and should be expected. The amount of drainage may temporarily increase with higher levels of activity. The drainage should be mostly clear or just slightly pink, like the fluid in a skin blister. You can expect this drainage to decrease over a period of a few days. You can expect to spend at least one night in the hospital. However, the length of the hospital stay varies based on individual patient needs and health status. After surgery, your surgeon may or may not order additional diagnostic tests. If you have any questions or concerns about your condition, ask your nurse. During your hospital stay, you and the medical staff will work as a team on your recovery. Your responsibilities are: take in clear liquids slowly, walk every hour while awake, use the incentive spirometer for breathing exercises. The nursing staff will instruct you on how to use the device. Use compression devices on your feet whenever you're in bed. Take adequate pain medication. You should be comfortable enough to take deep breaths and get out of bed frequently. The medical staff will be responsible for monitoring your vital signs, lab results, intake and output of fluids, incisions, pain, and nausea levels. Thank you.